The procedure being done is range of motion of the wrist joint in radial deviation. I will be performing active range of motion, which is where the client will move the joint under her own neuromuscular power, as well as passive range of motion when the movement is performed by the practitioner and the client is exerting zero effort. For this range of motion assessment, the client will be seated with the forearm pronated while supported on a table. The OT practitioner will be seated across from the patient. I will also be sure to be aware of any contraindications or precautions before performing this assessment. First, I will make sure the client is in the appropriate posture, and then I will palpate the capitate bone at the base of the third metacarpal for the fulcrum placement. My stable arm is in line with the midline of the forearm, and my movable arm is in the midline of the third metacarpal. After documenting my results, I will then perform a passive range of motion assessment where I will move her hand towards her thumb side for her. The client should exert zero effort during this assessment. The joint should have a hard end feel. The goniometer placement is the same during both active range of motion and passive range of motion assessments. The normal range of motion for this movement is 0 degrees to 20 degrees. This can be used in tasks such as drinking from a cup.